Are you a registered organ donor? Do you know an organ donor recipient? After today's video, hopefully you can answer yes to both those questions. Jared is the reason I've been an organ donor since I was about 17. A 3-time kidney transplant recipient, Jared is genuinely one of the nicest people that I know. His attitude is always positive, his personality easy to get along with, and conversation with him is always an open book. Sit back and enjoy my chat with Jared Provost. And then, if you haven't already, please register to become an organ donor.
But you mentioned your tattoo in your bio, and I don't know if you have more than one, but it's ironic that you mentioned your tattoo because that is one of the defining things that I actually remember about you. And that your tattoo is probably one of less than 10, maybe even less than 5 tattoos on people or individuals that I can remember being so unique and so well thought out for what it is and what it means to that person. I have always admired that particular piece of art. Can you tell me the story of that?
Which I got, okay, so I have...
So you do have more than one. The one I'm remembering is the Scottish one.
Yes, for sure. That was my first one.
Yeah.
That one is basically the map of Scotland. And inside the map, there's a maple leaf. So I'm Scottish and Canadian. So the maple leaf obviously represents that. But then within in the background and the color of the island of Scotland itself is blue, but then with the St. Andrew's cross in it with the maple leaf in the middle. So actually how I came across that is I just said to my dad, I have scars, many scars on my body that I didn't volunteer for, and those are there for the rest of my life. So can I get something that I do want on my body that's going to be scarred there for the rest of my life? So that's how it kind of changed. And that was 19, or I think I was just maybe 18, 19, just turning 19. And I told them first what I was going to get, and I actually drew probably 5 or 6 different copies of different images. So yeah, that's the meaning behind that is just basically Scottish with, or Canadian with Scottish roots.
It's interesting because you explained it to me and then you summarized it by saying you're Scottish and Canadian, and that's where that came from. For me, what I heard you talking about, and something I didn't know about it, and is going to make me remember it even that much more, is the fact that you do have a significant amount of body scarring that was not your choice, and that this was the first body scarring or body marking that was your choice.
Right. Totally right. Yet even at that time when I got it, I still didn't have half the scars that I've accumulated over
even
the
more
last,
since then, right?
20 years, right?
What exactly was your medical diagnosis, and what was the medical treatment for it?
So I was born with what was called posterior urethral valve, so basically reflux. The easiest way to explain it in layman's terms, most people know what reflux is. If you have kids, you have boys or whatever, this can happen in them quite commonly. That actually you can cure with a pill now. So they've kind of fixed but I think mine was in a very extreme state. So basically the plumbing was backwards and it went up instead of down. So that's kind of in layman's terms of what happened to me. And my mom at 2 days old found blood in my diaper when she was changing it. And that's basically what started the whole thing. And went to Children's, and I was there for, I think, quite a long time as a baby. As a matter of fact, I believe doctors told my mom and my dad to just go home and pack up the nursery. But
that's rough.
Yeah. So they had to do reconstruction surgery to fill my basically refix my urinary tract. I did have one kidney basically, I think early days that I don't remember, worked like 10%. And my other kidney worked, I think, about 60. But the problem was I wasn't peeing. So then I had, as far as I can remember back, like anybody as a kid, I had urostomies. So basically, same as colostomy, but for urine, right? So, so I had a bag on the side, and they had nothing obviously hooked up to the urinary tract until it was all healed, and then they had to do more surgery to get that working later. Had my first transplant at 10 years old. As far as I know, the information with that is a boy that died in a car accident in Ontario. And of course, going through all that as a kid, you're just, it's like any other kid. You're just going along. Hey, is there a play area at the hospital or whatever, right? So I remember vividly, I think it was for the peritoneal tube they were going to put in, because it was a daycare surgery, being in the waiting room and playing with, remember those coin things that you put
sort of like
they had them everywhere. They still have them.
Wiggly abacus like toys.
Yeah. But you kind of do it all over the place, right?
Oh, my kids love those
I remember,
things.
being in the room there and waiting, and then all of a sudden I went in for surgery, right? So.
Do you remember thinking that you just didn't know any different, that this was your normal, or do you remember feeling like, why me? Everybody else is different.
First one.
It was your normal.
It was more of, just going with the flow, being told what to do. Go over here now and do this, and not realizing yet that I was different or that something was going on, or it was just a part of life. I mean, even today, I'm more comfortable in a hospital sometimes than I am at other places, because it's what I know. It's what I grew up with, right? 2002, my that kidney rejected.
That was your first one?
That was my first one that rejected,
Okay.
And for good. I was working at the boathouse at the time, and I remember I wasn't feeling good, and I wasn't peeing or something. I was having problems, so I went into the hospital, and they did like a scan and stuff. They found that my kidney wasn't draining properly or whatever, so they ended up putting a tube into the kidney to let it drain. So they're kind of trying to save it or whatever they were trying to do. I don't know, but having a tube there and peeing into it, I was like, no, this is not a way of life, right? So they said it was rejected, so I'd have to go on dialysis for the first time. So that was the first time it was.
And then there's issues with the site, right? Because you had issues with like your central line.
Oh yeah,
that, was getting infected or was closing,
or even the fistula. So you can see scars all in there.
Yeah,
that was
right.
And fistula.
Yeah. So
but that's gone down now because it clotted when I'm transplanted. So it clot.
Yeah, so it's not without its issues. It's got a lot of pros. It's not error-free,
system.
Right? Yeah, of course.
Nothing, like my nephrologist said, nothing beats the organic thing, unfortunately. But
of course.
Yeah, and of course, like anything else, there's ups and downs, and I'd say more ups and pluses than downs, but the downs just seem so much intense.
Yeah.
But so 5 years I did it, and with all the issues and stuff that came out with the machine, I was just like, you know what, Dr. Copeland, he was my nephrologist for, since I was 19 until I was on dialysis, because he's in charge of still to this day, of the nocturnal program for the home program. And so I describe it, it's the best option besides a real kidney, in my view, to this day.
In terms of lifestyle, for sure, right? And it's also got to have, like, not just the time, but the consistency, right? Because if you just did one full 24-hour day, that's not going to replace, the couple hours.
Then you're just going to go and you fill up all that waste and fluid again right away. Yeah. It's really the frequent time you do it, because you can do it every night if you want, but that was becoming too much for me. Some people love it. They'll do it every night. They don't care. They'll do it. But for me, it was kind of like, well, this is my second fistula, and the less runs I do, maybe it's better for it. You know what I mean? Not just that, but it's better for my mental state.
Yeah.
I did every other night, but for 8 hours, that was still way better than doing it 4 hours 3 times a week. So
yeah, absolutely.
So
Yeah.
So I was only on a short time. That dad found out he was a match, and then he came in and donated, and that was a cool experience to be able to go through it, you know, with a loved one and stuff. And that lasted 2 years. That didn't last very long at all. I did have a year later, I had a rejection, which rarely happens after a year a bit. And so I was in the hospital so they could pump me full of prednisone to try and get things turned around. It didn't turn around. It had some damage though, because my creatinine was on a level a bit higher than what it was before constantly. So, but anyways, then a year later after that, it was gone and there was no return. So, so I went on dialysis again, and that was 10.5 years till I got my third. So, and then, of course, during that time, I started doing independent, becoming a spokesperson for that on the golf poster and for Renal agency and stuff like that. So doing a lot of work with them. I actually continue doing work today.
What was it like to have your dad have a glimpse of what you had been living with your entire life? And how did that either strengthen your relationship or change your relationship?
It didn't really change much. My dad is pretty straight up, like gets emotional once in a while, but not a whole lot. So it's it was pretty powerful in a way to see that I'm looking for a word. I guess humility a little bit in that, but maybe humility is not even a word. But I just think I don't know if it's really made me our relationship stronger per se. I think it was always strong, but it definitely shows, you know, a love of a father to a son for sure. But I remember that back till I was a kid. I mean, one of the surgeries I remember laying in bed, and it was at Children's, and they had a Super Nintendo machine or something in the room. And of course, Dad stayed the whole night, but every time I would kind of wake up and look over, he's still playing the video game, right? So, I mean, that in a way, it was good to see that, but in another way, it was seeing him by my side, you know, all night. That's what I saw out of it, not just, oh, he's just playing video games, so he's having too much fun, right? But then he would get up. He might have played all night and slept an hour, but he would get up and then go to work the next day, right? So this is just who he is. But there was also backstory to that I've actually been talking about more that people don't know about what happened with my dad's kidney, is that a lot of times, or not a lot of times, but I wouldn't take my medication because it didn't make me feel very good. But I also didn't take it because I wanted to feel normal and all that stuff. So that was a big contributed factor of why it rejected and didn't come back. So I think in some ways there's lots of pain there, but at the same time, it's hard to see. I'm still trying to get over that fact of what happened, but I had to learn from it too, to move forward. Kind of a growing up moment, and it still hurts deep, but what he did doesn't change anything. So, yeah. So it's kind of a bruised discussion, but you know what, I'm trying, you know, I'm trying to get over it, and I can only move forward to how I do with this one, and I'm doing everything I can to keep it as long as I can, so not to go back and make any of those mistakes. But that was also a learning point, was going on nocturnal dialysis, and nocturnal dialysis has really changed me as far as making that point of taking care of myself and doing what I need to do to stay alive virtually. But so yeah, with the dad thing, but we're a lot closer today too, because we both love cooking and we do lots of cooking together. And I mean, there's no love lost between us, and he knows, he knows what happened with me and stuff like that. And he's like, one thing they teach you when you donate a kidney is, the kidney's not yours anymore. The kidney's now his and his responsibility. So what happens further now is his, right? So, and my dad took that very seriously. So there was no, I think I have more bruised from it than he is.
Or guilt.
Yeah. Guilt is a great word. Yeah.
Do you...
Guilt, yeah. More open when I've been seeing, because I have been seeing a counselor in the past year or stuff. So
I commend you for going to counseling, first of all, because I think that is also something that mental health awareness is growing in popularity is the wrong word, but it is growing in popularity in the sense that it is becoming more acceptable to talk about, and people are becoming more. And
it actually wasn't since and just for the past year. I mean, I was seeing counselors and stuff before, but was related to kidney stuff. But then, of course, when I was out of dialysis, it changes, right? Then you're kind of on your own. But it changed in the past year because I was having severe anxiety attacks and, waking up in the middle of the night with breathing and purging and not knowing why, and thought it was kidney, but it's not. And so it was, I think what it chalks up to be is all those years that I was on dialysis, for that 10.5 years, I had to just keep moving and couldn't deal. Like I couldn't deal with the stuff that was actually going on. And then it was kind of like all that bundled up and then all of a sudden just released in the last year, right? So so since seeing somebody on anxiety medication, I'm doing great so far.
I've been in and out of counseling. I would describe my whole life. It feels like the better part of my life, anyways. And I think growing up, my mom was a therapist as well, and so the culture in our household was that it's exactly that. It's therapy, right? You don't think twice about going to physiotherapy if you have a sore neck or muscle ache or whatever. You don't think twice about going to the dentist if you have a cavity. Like if something's not right, you are probably ill-equipped to fix it yourself, right? And so I do think it's good that people go for a mental tune-up every now and again, and
need it.
Even if there's not one thing in particular, there's probably something that could be dug up and torn apart and dealt with and then thrown away, right? So good for you. So I just wanted to say that because I'm sure whoever you're talking to is already telling you and helping you through the releasing some of that guilt, because I think it's important to do. I can certainly understand the thought in that, and I can only imagine, how that would feel. But I think ultimately, and speaking as a father, and you're a father, I'm sure you can relate to this as well, that your dad's probably just very happy that, you're doing well now. Right. And that's probably all that matters. So,
it does.
So you got to give yourself a break too.
That's definitely what she says as well.
Okay, so there you go. So there's my non-credential therapy session.
So that's not going to cost me, right?
No.
That's free.
That is free advice you didn't ask for.
So the adventure begins.
Yeah. So November 17th, 2014, you come into possession of your third transplant.
Mm-hmm.
And from what I remember,
Yeah.
you were on a list for a while and you had pretty specific criteria that made it hard to match you.
Yes. So when you have multiple transplants, you become susceptible for others. So basically, your body will, the antibodies that you have in your body that will, on anything, whether it's a virus or whatever, fights it, um, keeps it away from, with the antibody treating that virus, right? But the same goes for a transplant. Your body's going to fight. If I don't take my drugs, then the body's going to be like, what is this thing? We want to reject it, right? So the more rejections that happens, your body more gets used to those. It builds up the antibodies that will fight. If I have another transplant, it will just, there's no point. Basically, it comes down to there's no point in giving me another one because it'll just reject. So you become highly sensitized, I think they call it. So, and of course, being O negative, which is the universal donor. So if you're not on the top of the list, then you're not getting one anyways. Because, and of course, there's viruses and other things that other people have had. If I haven't had them, then they would have to. Then you couldn't have it because then you're dealing with viruses and stuff. So. Anyways, so basically it comes down to it's a hard match because there's so many things against me, right? Having the multiple ones. So I mean, I might as well just tell you the story because it's in all part of it. Because so it was 35th birthday, a day before or 2 days before. October 11th, 2014. That beforehand, I always know something's going on because when they do cross matching, so when they start matching for the kidney and know they have one or a potential donor, which could be living, right? So they do the cross matches and stuff, so they send off a lot of blood work. And I always do my own blood work. So after dialysis, usually you do pre-blood work sometimes and post-blood work. So when I had it one night going into dialysis and she says, oh, you got extra blood work. And she wants this whole load of blood work. I'm like, So anyways, they did that a couple times. I kind of had my, radars up. I kind of know what's going on, but I don't get my hopes up because, I've had my hopes up before when I was a kid. My first transplant, they had a false alarm. So they called us. We went in, blah, 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 checked the kidney function or checked the kidney, and then it was too damaged, right? So you're never for sure.
Sure.
So a week passes by and whatever, and then all of a sudden we get a call from my nephrologist, Dr. Johnson, to come in. So we came in, and on 2 days before my 35th birthday, she said, we have an exact match for you, and you're going to get a transplant. And we're just like it was just like, what? I mean, Heather started crying right away, and then even Dr. Johnson, she was crying because I don't think they ever really thought I would get another one, right?
Yeah.
But the only way I would be able to get it was an exact match. Otherwise, they never would have transplanted if it wasn't exact. So the previous two donors that I have, they were compatible, but they weren't exact.
Okay.
So anyways, they met the markers and set the date to when I was going to get it. And actually the rest of that day, because when you get the news, you're still kind of in shock a little bit. Because I was honestly, Derek, I was living my life like I was going to be on dialysis.
Like that was
the rest of my life. Yeah.
You were on a list. You were on a list expecting never to be.
There's that hope, right? But you kind of like where I say there's hope, but I still know reality of what's reality. And so I was still in shock. And I think Julie called and said, Mom and Dad are coming downtown to meet me at the office. You guys are already at VGH. You want to meet us for lunch? We're like, okay. And of course, I wanted to tell everybody at the same time. I wanted to tell some people, then the other people. And so we went for lunch, and the whole time, Heather and I are just like knees shaking and all this other stuff, but we're keeping pretty cool. And then we finally got home, and I wanted to tell Mom and Dad first, so then I told them, and it was just tears, and it was great. A great moment, right?
Mm-hmm.
Probably just as great as the moment when he donated to me, right? So, and then of course we all went out. We went out for sushi in South Surrey there at Maguro Guy.
Oh yeah, nice.
On my birthday. So, and we celebrated at the same time. And I didn't tell Quinn and Aaron and Julie and Kevin until we all got to the restaurant and told them. So Julie just about screamed right off.
Oh yeah.
But anyways, so that's sort of how we found out, and it was a total surprise. And so getting to more of the details was, it was a non-related, anonymous donor. So the person's still out there.
So living donor. Okay.
Living donor, yeah. So now I've had a kidney transplant from every single option you can do. A cadaver and a deceased, and living donor related, and then anonymous unrelated donor.
Okay. I'm curious about the anonymous.
So
do you have the choice to know, or did they have the choice?
No,
it would have to be their
choice. They have the choice to reach out or not. Yeah.
It's their choice, not yours.
Well, it's government's choice. It's actually a government issued thing.
Okay.
But you can write a letter apparently to the person that gave it to you, and then they have the choice whether to contact you or not.
Okay.
So apparently I was part of a chain. So you know how they have those chains nowadays? I don't know if you heard through the organ donation, where say you wanted to donate to a loved one that didn't have the same blood type.
Okay.
I'm just going to make a short chain just to make it easy.
Sure.
And Heather couldn't donate to me because she has a different blood type, but she matched your loved one and you matched me.
Okay.
So you're doing the crisscross, right?
Right.
So now they have chains where a couple, and then a person that wants to donate, a couple, but then they need to link the chain back together.
Right.
And apparently I was the link back together of the chain. I always say I won the life lottery. I actually wrote an article right after it.
Yeah.
A little article about winning the life lottery. But
well, I appreciate you taking the time to talk. I do want to ask whatever comes to mind as quickly as it comes to mind. There's no right or wrong answer. So,
is it one word?
No, you answer it however you want.
Okay.
What was your worst job ever?
Busing at the Shady Island.
Okay, bus boy. Yeah.
Yeah. But not and only in that restaurant. Let's just put it that way.
Okay. I may not name the restaurant in the.
I don't care.
In the final here, I don't even know if they are a restaurant. Are they?
Yeah,
Shady.
They're still there.
Oh. I've eaten there. They serve decent fish and chips, but
yeah, that's about all you have in Steveston anyway.
Yeah, that's all you go for anyways, right?
Yeah, totally.
Yep. What podcast do you recommend the most?
White Coat Black Arts. It's a CBC one.
Okay.
And he talks about kind of both sides. He was an emergency doctor, so he talks about the basically medical system, but then he usually interviews all three people, like somebody that was on, maybe the doctor on some story, and then he talks to the patient, gets to both their point of view sort of thing. It's actually quite interesting, and some topics actually come up that I never knew in the medical field and stuff like that, right? So it's just interesting. I saw him speak at BC Renal Days this last convention, this last October.
Okay.
So yeah.
Okay.
Really. And then I ended up getting his book too and reading it. So
Cool. Okay.
Yeah. Okay, next one.
If you could give your 20-year-old self a piece of advice, what would it be?
Be more motivated.
You mentioned cooking
Mm-hmm.
as a hobby, pastime, passion, however you want to describe it.
Mm-hmm.
What is your go-to feel-good food?
Faux.
Faux.
Yeah. Or
Faux.
pho,
Faux
however you want to call
show.
it. Yeah.
You know, I said faux show and I started writing faux show.
It's actually a tie. It's either pho or sushi. Both of them I love a lot, though. So.
Okay, faux
So
or
Asian.
sushi. Yeah. West Coast boy. I mean, it's both,
Right?
both
Yeah.
excellent choices.
Yeah.
Yeah. That those are all the questions I have. Do you have any? Do you have any questions?
It's not more of a comment than a question. Is that when I heard you're doing something else, I've always known you as like you're always like seems to be working, or you're, and that's one of the things. Like when I said motivated, actually, you were one of the people when I was younger sort of looked up to because you were so motivated in whatever you did, and I always admired that. Right. You just without any thought you go and do something, and I was just but like as in a business side of things, like you didn't worry about running your own business and doing all that stuff, and I was just like, oh, this is crazy. I'm still could figure out what I want to do, but
Me too.
but I know we all do, right? So
Yeah. Oh,
but
that's
yeah,
really
no,
kind.
that's one of the things I remember the most when we were younger, but also of course having lots of fun. But how's everything going there?
I really am trying to focus on the positives and focus on being grateful and not focusing on what I've lost, but what I've gained.
Yeah.
And I do better at that on some days than others. You know, there's a lot of days where I miss my friends, I miss my activities, I miss I miss my job. Like I'm not selling much real estate right now, right? And you know, and I never saw myself as a stay-at-home parent or a homeschooling parent, and now I'm both, right? And so,
well, now how is, I mean, besides the obvious, how do you like as a stay-at-home dad myself, how do you find staying home with them all the time?
The good days that we have are always the days where I'm just go with the flow. The bad days that we have are always because I've expected that I can still operate all aspects of my life before COVID, just in a different way now because of COVID. And of course, you can't do that, right? It doesn't work that way. You can't just transition your life out here to now inside and make the adjustments and have it be the same.
Well, I expect just to go smooth. Yeah.
Well, it's not even go smooth, but expect it to be the same because it's just not the same, right?
Yeah.
And so the days where I have properly adjusted my expectations to say, okay, you know, this is what we're going to do today, and that's it. Those go way smoother, and obviously everybody's happier because of it. Just before I go, because I want to be respectful of your time, and like I said, I didn't sleep very well last night, so I do want to head to bed. But I'm glad you won the lottery, and I know Heather is, and I know Leland is, and
oh, for sure. Then a year later, it was Leland was born, right? So you can't ask for a better layout of timeline. No. So really, because I really can't imagine doing that now. Going through dialysis, this is what I'll end on. Going through dialysis, I was like, oh, so tough and all this. And then when we got pregnant, I was like, parenting, piece of cake. I did home dialysis for 10.5 years. How can I get harder than this? Boy, was I wrong. Parenting is way harder than doing dialysis. When you take care of yourself, that's one thing. But then when you got to take care of a small human, it's a whole nother ballgame.
Yeah. Okay, quick one more. What's your best dad joke before I let you go?
I don't have very many dad jokes.
You don't have any dad jokes?
Yeah, I'm sorry. Sorry to
for
disappoint.
sure.
What's yours? I'm sure you have one.
What state is responsible for ultra small soft drinks? Minnesota.
Oh my god. On that note, I think it's time to sign off.
Thank you, Jared. I appreciate your time. And,
All right, man.
Let's stay in touch.
Hey, we'll have that social beer.
Absolutely. We'll see you at a happy hour one day. Okay?
All right, man.
All right. Take care. Say hi to Heather for me.
Stay safe. You
All
bet.
right.
Bye.
Talk to you later, bud. Yeah.
Bye.